Hello, everyone. I am Maria. I'm the CEO and co-founder of Tucuvi, and I'm going to tell you a bit about my life. I was born in a small village at the center of Spain, and when I arrived to this world, she was already there. She's Carmen. She was my neighbor. She was 70 years old and also the most active person I knew. I went with her everywhere, from church to the city to see her doctor. But 5 years ago, her life totally changed. Her husband passed away. She was diagnosed with a cardiovascular disease and she already had diabetes. So she started to feel sicker and to go too often to the hospital. And I was no longer there to take care of her. So I started looking for solutions that could help her better cope with her conditions and avoid complications. But all I could find was either wearables or mobile apps. And she wasn't able to use any of them. All she did when she felt sick was trying to reach me or trying to reach her doctor that obviously most of the times wasn't available for her. I couldn't believe this was only a Carmen situation. And in fact, 90% of the almost 90 million elderly people living in Europe live with at least one chronic condition, but an average of 4 chronic conditions per person. Besides the huge impact in healthcare costs and the concern of millions of families, what shocked me the most is that 1.2 million of deaths a year of this population, of these grandparents, can be prevented if they have access to the tools, to the continuous support that they need. So to ensure that every person that needs to be accompanied and monitored at home when their family or their professionals cannot be around, we created Tucuvi. Tucuvi is an AI-based voice-powered virtual caregiver who provides continuous care at home. It is a virtual assistant specialized in how the elderly speak and how they understand language, and that communicates with them via phone calls that can be made from the virtual caregiver to the user and vice versa. And as of today, Tucuvi is trained to maintain the most common conversation of the senior population. For example, she can make calls to monitor chronic conditions, to remind medications, to play cognitive games with them, and of course, to monitor COVID symptoms and detect urgent needs. Next slide, please. So start using Tucuvi is a very simple process. It is just a 3-step process. First, the healthcare or social professionals choose which type of call can better help each person. For example, for Carmen, we want to see how she's doing and to monitor, of course, her cardiac issue. Second, Tucuvi takes care of it. For example,
Good morning, Carmen. It's Lola from the hospital. How are you doing?
Hello, darling. I'm okay. A little busy because I've started painting classes, but I'm good. I love it.
Wow, so happy to hear that. And how were your walks this week? Did you have more trouble breathing than usual?
Well, in fact, yes. Since last Tuesday, I think every time I walk for more than 2 minutes, I feel like I can't breathe.
Okay, don't worry. I will let your doctor know and she will contact you. Is there anything else you want to tell me?
Everything else is fine, dear. Thank you very much for calling me.
And the last step is that while they were speaking, Tucuvi was processing everything that Carmen said and sending it back already analyzed to healthcare professionals so they know in real time who needs attention and with what. We not only accompany the user, but we also help healthcare professionals to monitor all of their patients. We save them valuable time and we help them make decisions faster so they can devote time and personal attention to the people who need it the most. We are bringing the latest technology, the latest in AI, to every home. They don't need to buy new devices. They don't need internet or to learn how to use anything because they just need to pick up their usual phone and start speaking. We work with companies that are already caring for the elderly, with telecare companies, public and private hospitals, and insurance companies. And our model with them is a B2B software as a service model in which they pay for an initial setup license and then a monthly fee per user. And we are helping them expanding their capacity of care. and evolving from reactive healthcare to health assurance. While one of their nurses or telecare operator can make up to 60 calls a day, Tucuvi can make up to 100,000 calls every day from the same telephone number. So we can reach all of the patients and maximize the impact of human attention. We founded the company 1 year and a month ago, and in this time we have the pleasure of being rewarded with some awards, but most important, we already have the trust of top hospitals in Spain and also of the biggest telecare company on the country. Since this March, we've been able to care for more than 14,000 elderly people aging at home, and we detected more than 3,000 risky situations that otherwise could have been detected too late or not detected at all. Our objective for next year is to increase our presence in Spain and also in Portugal, and to be able to care for at least 100,000 people. And we believe in the potential of digital healthcare to enhance continuous care of the elderly at home. And in that way, we are working towards integrating Tucuvi into public and private healthcare systems so that it becomes an efficient monitoring alternative in the clinician's routine. 2 years ago, Marcos and I started this journey, and since this summer, we are so lucky to have 4 new spectacular people working together to make Tucuvi the most accessible, empathic, and intelligent virtual caregiver ever. We are proud to be pioneering technology for people, just for people like Carmen, because although I know that I cannot be there every day for her, I love that now Tucuvi can. So thank you for helping us, making sure that she always has someone to speak to. Thank you for helping us making continuous care accessible for everyone.